Hello there, televiewers. Hope that you're having a great weekend. Well, it's always good to be in your company, and thank you so much for joining us on yet another edition of The Diary. Well, in these times of the coronavirus, we all are dealing with intense feelings of fear, worry, concern, and the unfortunate effect is that mental health has become an even a bigger public health issue. So, what do you know about mental health, and what is the relationship between mental health and the coronavirus? You get the answers in today's edition of The Diary. Don't go away. Welcome back. If you're just joining us, you're watching The Diary on STV, and today our subject is mental health and COVID-19. Also, we'll be using today's edition of the show to introduce mental health to many Cameroonians who are still very much in the dark about the situation. It's now time for you to meet my guests. Well, they are all members of the Cameroon Association of Clinical Counselors. I'm going to begin with the ladies. And I'd like to introduce now Reverend Dr. Funke. She's a clinical counselor and also a psychotherapist. It's good to have you on the show, Reverend.
Thanks for having me.
I know that there's so much we're going to be learning from you.
I hope so too.
Okay. She's not the only lady on set today. I'm also very glad to be receiving Madame Jackie Anyangoe. She's a psychotherapist and an EMDR practitioner. I tried to read a little bit on what that meant, and I learned it was an eye movement and desensitization and reprocessing therapy. That's a big phrase.
Yeah.
It's good to have you on the show, Madame Anyangoe.
Thank you very much. I'm glad to be here.
And one who is making a comeback on the show after a couple of months, Emmanuel Shiangong, who is a beauty consultant. You'll know him for that, but he's also a psychotherapist and a member of the advisory board of the World Federation of Mental Health, the Africa chapter. Always good to have you on the show.
My pleasure.
Now, we are talking about a subject which many Cameroonians do not master just yet. Now, once they hear the phrase mental health, people immediately start imagining very mad people on the streets. So, let me start with you, Reverend. What exactly, and in very simple terms, is mental health?
When we talk about mental health, we are simply talking about internal emotions, if I want to put it in a language that will be understood by all. We're talking about feelings, negative feelings, of course. Sometimes too much of positive feelings could also be mental health. Mental health is not something that can be measured by thermometer. Like if you have a fever, they will put a thermometer in your armpit and then your temperature is rising. Unfortunately, it comes through and it's visible through behavior, and sometimes it's not even visible. And so when we're talking about mental health, we are talking about little things like from fear to stress to clinical depression. And then, of course, you have chronic mental health. That's what everybody talks about when you mention mental health. They're thinking about the man on the street or the woman around the corner who's moving naked. But mental health begins with, what are your feelings? How do you feel? About yourself, about others, about situation. That's mental health.
Right. Now, going by the definition from the Reverend, we all at some point have to deal with mental health. Madame Anyangoe, would you say so?
Yes, I think that at any point in time, every one of us face mental health issues, because each experience that you have in life, you either perceive it positively or negatively, and it depends on the way you perceive this particular experience that will determine your mental health position with that experience.
Okay, so what are some of the common mental health issues in Cameroon around this time? Let me come to you, Mr. Shiango.
Yeah, thank you. In Cameroon, around this time, we've had a lot of anxiety, a lot of problems of anxiety. We have problems of fear. We have cases of trauma right now because of losing of loved ones, those who have been very close to us. We also have a lot of issues linked with psychosocial problems linked with our job crisis in business environment, economic drop, making people, having related issues to mental health like sleeplessness, headaches, and some anger also, and restlessness. These are issues that are very common now, and they can manifest in different ways. You can push people to bad consuming habits like, taking abusively alcohol and drugs, or creating problem in interpersonal relationships.
Okay.
So those are very common issues now. And of course, for the children, most of them were locked up. Basically, you can imagine kids in an apartment building who can actually not interact with their friends. Most of them have developed telephone and television addiction now. And if parents had not been used to home games with them, which, like we said, we may have to come to that. There have been issues where these children now will have to go back to normal life, but they have built within themselves some habits that may not just be easy to shed off.
Okay, and let me come back to you, Reverend. You're a psychotherapist, so
Yes.
you've been working with lots of people who have issues, patients
Yes.
who have issues. Generally, what kind of problems do your patients have? Typically, what kind of problems do they have?
When somebody is sick, the first concern is, am I going to get out of this? And so fear is a very big factor. Trust is another. Are they trusting that the medications they are taking is going to work to bring them out of the situation they find themselves? And then sometimes people have issues of closure. For instance, people who are terminally sick, they are looking at life, they are thinking, did I do what I was supposed to do before getting to this stage? And when I go, what am I going to be remembered for? How is my family going to be organized? So you have all those issues interplaying. And sometimes we say the psychological support is very necessary for the medication to work, because when the mind is disturbed, it interferes with the treatment plan of the clients. And now with COVID-19 is even worse, because the trust level of people has really dropped. You have people who don't believe that the hospitals will deliver the goods to them right. So they rather stay at home and self-medicate, and it's leading to maybe increasing the death toll of a lot of people in the country, because they think, am I going to the hospital to be treated or to be killed? And based on that fear factor, a lot of people think that, okay, let me live in denial. COVID does not exist, or COVID is a political disease, and because of that, you have a lot to do to externalize some of those beliefs that are not healthy beliefs, and try to let people assimilate what healthy practices that are good.
Right. Okay, and Madam Anyangwe, would you say the same thing?
Yes, I think so, because looking at the situation we have at hand, the COVID has made people to do a lot of self-medication, and we realize that they are causing more harm than good to themselves. Yes, as doctor said, people are avoiding hospitals, and it's because of the stigma that has been associated to the disease, and there's a lot of trauma that is also associated to the disease, and the trauma comes with a different kind of experiences that people face. People are faced with the COVID, but the way I would perceive it is different from the way someone else would perceive it. So with all of this put together, it makes people not to be able to accept it the way we are supposed to accept it, and they don't go for the right treatment protocols. They stay home and do what they think they can do for themselves.
All right. Now, there's a general belief that there is more total focus on the physical health, and very little is done about the mental well-being of patients. How true is that in Cameroon, Mr. Chango?
It's not only in Cameroon, it's a world problem. because if you look at the way our educational structure is organized, we learn mathematics, we learn physics and all the geometry, we learn even the history of Europe, we learn in Cameroon, we learn geography, we learn literature, we read all those books, but nobody is teaching any of our kids to understand what is to be sad, what is depression, what is happiness, what is feeling moody. Nobody teaches anything about emotions, and you realize that most Africans don't see mental health concerns as a disease. Nobody sees depression as a disease. They may say, well, you're weak-minded, or you want to be petted. We have things, and we have a Kenyan writer who said, when we had this American movie star who caused suicide, and he was writing on that, and he said, I can't believe that for a mood issue somebody will take away his life. Depression can be a disease. After all, in the African languages, we don't have a word for depression. So they will attach something else than a disease to it. And then, of course, we identify with the things we can touch, we can see, we can smell. You see, you can get a temperature. You can see a wound. You can experience diarrhea. So these things work out. Somebody losing weight, we can measure that. When you talk about somebody being in a state of anxiety, you can have 1,000 interpretations for that. So learning the language of mental health has to be something that we have to get into our tradition. There is nothing in place, no system in place that is bringing that as a normal situation in our education, in the world, actually. It's an issue.
And as a result, Reverend, mental health issues and patients dealing with those on a daily suffer because no one is really looking at them, no one is really paying attention to their issues.
Exactly. The first thing is the cultural beliefs that are surrounding mental health. Of course, before now, mental health was considered a punishment for doing something that a sin that you had committed against the community. So even people who had symptoms of mental health were immediately whisked off to either traditional practitioners, or they were condemned for doing things that had gone contrary to the values of the community. So because of that, mental health was suppressed. And even when the symptoms were showing themselves visibly, people pretended to attach other things to, for instance, they say like, this person gets strong fashion.
Yes.
Not the way they, that's how it behave. But they would not associate the change in behavior to something that had gone on wrong internally. So unfortunately, like Mr. Changon was saying, things is something that is not measured by the thermometer, and by the time it portrays itself through visible behavior, it's already out of hand. And because of those stigma, nobody can say that, okay, I'm losing sleep, I'm feeling moody today, I'm not happy, I don't know what's going on with me, let me see a doctor. Nobody thinks about that. And it's very easy, again, like now let me talk from the religious perspective.
Right.
It's very easy for those of us who are religious practitioners to just send off those people and say, okay, there's a demon that is present, and they spiritualize what is going on. And of course they put you on spiritual programs to pray and cast the demons and everything. I'm not saying that people should not pray when they feel that the spirits that are in people are contrary, but diagnosing every mental health situation as being spiritual is not fair at all.
Right. Now, another thing about mental health is that sometimes the people who are dealing with it do not accept that they have a problem. That too could be a hindrance to solving the mental health problems that we have, Madam Anyangwe.
Yes, I think that you're right about that. That could be a major problem. But I think one of the main issues is lack of sensitization. People don't know about mental health. And I think it's our duty, like medical practitioners and all other stakeholders, to be able to get ways of sensitizing the public about mental health. Some of them don't even know about it. And like medical doctors, I don't know the treatment protocol for mental health in Cameroon, but I think it should be more of a holistic way of treatment. When you go to, take for example, the COVID that we are facing now, if we have a COVID patient and the doctor treats the patient, it's normal that the doctor should refer to a psychologist, especially if you notice that is somebody that is not very strong emotionally. You refer that person to a psychologist. So the treatment should be like biopsychosocial. The doctors who do the biological part of it, the therapists who do the therapeutic part of it, and the social part of it is the family and the community around that person. If you do these three things in place, that's what will help to get a holistic treatment for the COVID. Not just treating somebody in the hospital and tell the person to go. The person goes to their community, they are being stigmatized, they're having issues in their mind, and all of that, they are not completely healed. So if we try as much as possible to sensitize ourselves, the practitioners, and sensitize all the stakeholders on how to handle this situation, I think it will be better for the community.
Right. So we promised you today that we'll be talking about, or we'll be looking at the link between the coronavirus and mental health. So far, we've picked a thing or two. But now I'd like for us to focus on it for a bit, Mr. Chiangong. What's the link between adjusting to a new reality? Because it's a new reality for many people as a result of the coronavirus. What's the link between that adjustment to issues with your mental?
The first thing is that you realize the way COVID visited the world. I mean, we came in somewhere at the end of the journey, and the media was doing a lot of talking about it, and there were a lot of theories that came up, a lot of theories. Some people said it was a scam, and some people said it was a strategy to put chips and vaccines into people, So by the time COVID came to Africa, we were like waiting for an enemy. And everybody had armed themselves in various ways, in terms of theories, in terms of ways of behavior, in terms of diet, in terms of attitude towards doctors even. So even right away when doctor was talking about the situation in the hospital and Madame Jackie, you realize that the doctors even were suspected. The confidence level had dropped seriously with medical institutions, which normally we are raised to believe in them. We believe in the religious leaders and the medical corps, and then maybe the lawyers and the judges. We've grown that way in a good society. But this time, everybody had the courage to question the medical facilities. And then, of course, there's this aspect that death was imminent. There was death that was logically attached. I mean, when you look at the statistics, it's a bit unfair to just attach death to COVID. And so when you anticipate death, you look forward to it, and you act like somebody who is about to die. So the behavioral and the cognitive process of this person certainly makes him construct his or her death even before it really comes. And this is not good for any therapy, because you can be also in a mood where you are not very receptive to healing. And now, the way it was communicated in our country, you see, nobody was, they did their best, and this is using what you have.
Yeah.
But this is again because we don't consult in a broad-based manner. You see, when you tell people you have to wash your hands, you should also tell those that are already coughing and sneezing, this is what you should do. And if you are nearby this person who is coughing and sneezing, this is the way you should. Don't disown your own person. Or if you are feeling this, if you are going to the hospital, if you are taking treatment, or you are feeling like this, don't be afraid of this or that. And they have to also help people to feel that death was not a logical and that it was not maybe some grace, you know. So even treatment procedures, I would be honest with you that I talked to some doctors and they said there is no treatment. Actually, they just give you treatment for the somatic manifestations. Whether if you have fever, they treat fever. If you have pain, they treat the pain. So this link, and just fear alone, the anxiety that comes, the anxiety that brings about what you would call despair, leads to depression, naturally. And sometimes people who are around you, they are saying that, well, it is likely they start to prepare themselves to lose this one, you know, rather than telling you that you can make it.
And if we're being very honest, I think somehow in the media we contributed to that fear. Unfortunately, misguided, because the goal was always to give people information, arm people with knowledge so that they prepare, except that you're arming people with one kind of information and then leaving them completely empty when it comes to mental health. Thankfully, things are changing and now people are learning what to do.
No, we're talking more about the disease. What about those who were locked up at home? They were not ill. You know, you have to live with a woman that you have known only at flash minutes when you come home to sleep. You have to sit with her from morning to evening. Some women and men, they have to work from home with kids that were out of school, and they have to run into you when you are on a Zoom conversation or something. Daddy, I need this, daddy, I need that. You know, so many issues came up that were really emotional, and the pressure could have been a bit unbearable.
Yes, and Reverend Funke, I was reading that the number of divorces went up. You know, the amount of couples that were splitting following the confinement in many parts of the world was increasing, and it's because they were, like Mr. Changong was saying, they were forced to really live with each other and see each other for, you know, who they really are.
Of course, because when you have couples who have known, let's say they meet at home at 7 o'clock and the time they spend together is like a couple of hours before they go to bed, and then you have them staying from morning till evening every day, they are going to discover things that they had not known about each other. And of course, social media doesn't help either, because there are a lot of discoveries that are made when now you have to concentrate on each other. And then soon you start realizing that the man you thought was your husband or the woman you thought was your wife is actually somebody else. And you start asking questions. Why am I still here? Is this what I have been, is this what has been hidden from me all this while? It's obvious that the divorce rates will go up. Of course, let's take the positive part. It also helped families to spend quality time.
That's true.
Because there are families who don't know their children. There are couples that don't know their children.
Especially with the children.
Especially with the children, because children now had to have the privilege of staying with their both parents at the same time, because it's either, especially for working couples, it's either mom or it's dad at one point of the time, but not both of them from Monday to Sunday, you know. So the quality time that was spent is good. We also have to know that of course there were some issues that would come up with the lockup, like Mr. Changong said, addiction problems. Sometimes you don't know what to do with yourself. Let's talk about families in the cities. In the rural areas, it's easy. They could jump behind a yard and do some gardening or farming. But in the cities, imagine a family that is locked up on the 4th floor in an apartment there, and they have to stay there for 1 month. What do they do with their time? So they start developing harmful practices that, like drinking, game addictions, phone addictions, and it lands us in another sphere where we have to start looking at what do you do after COVID, post-COVID, to externalize all these practices that are going on now during the COVID period for survival.
True. Another problem that many have been talking about as a result, as a fallout of the coronavirus, is rape, incest, because, well, everybody's locked up, everyone is at home. That's another issue that people have to deal with, Madam Anyangwe.
Yes, that also is very common. during this period is because of maybe the accessibility to the individuals. A brother or a sister that are a cousin that maybe was living in the house and is going out for work every day, but at this point they are bound to live in the same house. They don't get to meet their sexual partners as they normally would do, and all of that. That would push them to do some kind of malpractices that otherwise they wouldn't have been able to do that. And I actually read a good number of rape cases during this period of little children that were being raped by their relatives that were staying at home. I also think it's because of the confinement, because the fact that you're not going out there and to do the regular things that you're supposed to be doing, you are bound to look for a way out. As the doctor said, addictions and all of that, people who have high libido tend to look for a way out, and since they cannot do it, they go for what is available, which is their relatives around. It's such a bad situation. It's such a vicious cycle, this COVID.
True. Now, another group of persons that, in my opinion, correct me if I'm wrong, do not get the attention that they need, especially now, is the health workers, the frontliners, the doctors, the nurses who come face to face with very sick patients, who watch their patients die, who are permanently concerned about getting infected, about getting their family members infected at home, and they have to deal with an even bigger problem when it comes to mental health.
It's a very, very unfortunate situation, Manda, because this whole thing has to be a global platform in which, like I said, the consultation should be broad-based. When you consult the professionals involved, they will tell you this is our duty, and we'll be able to intervene at this level, at this level, at this level. Forcefully, they will tell you the military can come in at this level, the fire brigade can come in at this level, the clinical professionals in mental issues can handle this way. The situation around the patient and the caregivers or the medical practitioners is a very conflicting one. It's your job. You have to do it. You have an oath to do that job. You have your life at stake. But some of them have a very strong relationship with their patients. Some of the patients, they go home also very depressed when they find themselves unable to save a situation. Some feel even guilty. And the sad thing is that they are not in the picture. You're raising it here, but in most of the discussions, you don't really have it like a frontline discussion. Meanwhile, it's a very, very serious matter to be all day knowing that I have lost one, I have lost two, and that I may likely lose the third. Your whole mission looks like running in the opposite direction. It can be very depressing. And that puts them in a more fragile situation to be infected, because when your depression goes high, your immune system drops. And so it's a situation when we discuss it now, I start asking myself what one can do, for people who have been really involved at this point. It's never too late. Maybe by the time we leave this place, we may be able to come up with some suggestions, because it should never be too late to do something. Yes,
that's the goal of the diary, to bring help to those of you who need it in this situation. Those of you who are in need of assistance with mental health, we are here to do our best for you. Would you have anything to add to what Mr. Chengong said, Reverend?
Yes, I think that unfortunately the way our health system is set up in Cameroon, I don't think they give enough place for staff support, where at the end of the day, the emotional feelings of frontliners could be checked. You are dealing with health workers who are facing death, because like you just said, COVID was synonymous to death when it just came, and you're asking a health worker to face death and either conquer it or get conquered. And yet the feelings of these people are not taken into consideration. I would think that hospitals need to set up staff support systems where at the end of each day or twice or thrice a week, the staff can come together and talk about their experiences. Because talking about it will help to unearth their feelings and unearth whatever issues they may be experiencing, and they may have help from each other if they don't have professionals. I'm not even going to say they could have professionals to do group counseling with them, because I don't think we have those professionals available in our systems. And I don't even know whether our hospitals have people that are there just to take care of the emotional health of staff members and patients. Some may do, but I don't think the common hospital, like those who are like those handling the COVID-19 cases, I don't think that the frontline workers have anybody taking care of their emotional health. That needs to be done.
You would think that as stakeholders in the medical field, these directors of hospitals would know this, but it's not as obvious as we think it should be. What's the problem? How is it that they do not yet see the need for these frontliners to be taken care of properly when it comes to mental health?
I still think it boils down to the sensitization issue. Okay. Because for example, when we had the Ezeka train accident, there were people who were trying to create what they call the cellule d'écoute, the cell where they can handle the people to do the first aid, the psychological first aid. But when you bring it to the authorities, according to what somebody told me, they were receptive, because I think they don't know the value of it, because the mental health doesn't have that stronghold in our system. I think even in our workforce, the mental health doesn't have a place. I don't know about that, but I think it doesn't have a place in our workforce. So putting all of that, if you come and say we need a mental health unit to handle first aid when a situation comes up like this, the people in authority don't even know about it. And I think it's up to us, the people of the mental field, to come up with write-ups, to come up with seminars, to be able to make them see the value of what mental health is in our community.
Now, just before the show started, Mr. Shango, you were telling me how it's, I don't know if it was you or one of the ladies, but in the conversation, I gathered that it was just a few years ago that the government of Cameroon decided to, work on a day for reflections on mental health. Why are we late on this? And these are the daily issues. These are the problems that concern everybody. Why are we so late?
I would like to say something. It may be a link to that. Madam Jackie, I would like you, well, this is my view. I also think that mental health is not commercially interesting.
Oh, okay.
I think it is not commercially motivating. We don't have much to sell in terms of material, like drugs, like in terms of infrastructure, institution, and then the marketing around it does not exist, and you don't have insurance that covers mental health issues in this country. So all of that, it makes it not interesting. People, when you reason in terms of what do I make out of it, what do I gain from this situation, you will certainly not be sensitive to mental health, and you will not be motivated to be interested in it because of the material gain. That's the one aspect. Well, like I said, the whole mental health industry is suffering from stigma everywhere in the world. In Africa, we don't even have a word for it in our dialects. When we went to school, we were thinking of being an engineer, a medical doctor, a reverend pastor, a priest, and maybe a mathematician, a lecturer at the university. Mental health, like doctor said, was seen as maybe a taboo, because the people were certainly cursed, or some bad luck befell them, or they put their hand somewhere, as we see sometimes in our surrounding. And so, somewhere, don't get involved, because they certainly look for it. You are not really very sure about this case. So all of that relegated it to second position. The education is coming. More people are facing issues of children born with defects in very good homes, where they are very knowledgeable, that pushes them to become sensitive. Now we have situations facing most of us so close to our families that due to the love of family, some are getting to educate themselves, and programs like this can change it. So the back position is not only Cameroon, but I said in Cameroon, I think that the motivation doesn't come first place because of the maybe economic interest that it can generate. But again, I also realize that we don't have many professionals who have trained. Again, that may be because nobody's going to...
That was going to be my very next question.
Yes. We don't have many professionals practicing mental health, and this may also be due to the fact that the motivational incentives, when you come with such a know-how, doesn't really exist. Like I said, we don't have insurance coverage. It will not help things like that to be taken care of. Meanwhile, the psychiatrist, who is having a very, very medical in terms of pharmacotherapy, may benefit from that type of it. The psychotherapists, the clinical counselors, and so on do not have that same impact.
So we've already agreed that we don't have the staff strength when it comes to personnel. Let's talk about the training. Is it difficult? Does it take too long? Because when I look at the years and what it takes to become a medical doctor, a general practitioner, and I look at psychotherapists like yourself, and still we don't have that number in Cameroon, maybe the economic value like you said. But tell us about the training, becoming a professional in the field of mental health. What does it take?
To practice, you need a basic degree, first of all, in one of the social sciences or in sciences before you get into the professional aspect of training, because it's a postgraduate training. Okay. However, again, when we go to cultural beliefs, I'm sure some of them will tell you their experiences when they were training. You tell somebody you want to become a clinical counselor or a psychotherapist, and they're asking you, what are you going to do with that?
Exactly.
What will you do with that? Because they're looking at it, there's no market for that. So people are not interested. They say, okay, that sounds like something that's in the Western world. What will you do with it in Africa? So the motivation is not there, because I don't see a child who get up and tell the father, I want to become a psychotherapist, and they will not tell you, okay, since it's in medical field, why don't you just become a midwife or a doctor or a nurse or something like that. So again, that goes with what we think about mental health. Now, the training process may be cumbersome, but it's very rewarding. Because for you to become a psychotherapist, you're first of all working on yourself, because you cannot give out what you don't have. And the profession is like, if I can put it in some idioms, it's like everybody likes to drive a car, but they don't like the mechanic. and being a psychotherapist is just like being the mechanic that takes care of the engine, because okay, I'm going to spend money on something that I don't see, but then it's something that makes you to function properly. So if you tell, for instance, a company to employ a psychotherapist to take care of the workers, they are going to ask you, what income are they going to bring in? Let's say if we say we get a psychotherapist to come and work in STV. The first thing is going to be, okay, what's going to be the benefit? The benefit of that is, again, the mechanic behind the scenes. So like you say, the training is not sellable, because culturally, the way we handle our issues, if you have a child that is mad, you hide in the room, because you don't want people to think that you did something wrong. So, and then even psychiatrists are being considered half mad.
True.
Yeah, because they're dealing with people who are not normal according to society. So if we are dealing with people who are not normal in society, how do you get attracted to go and work in that kind of position? Those are the cultural hindrances that we face in the training.
Right. Now, Madam Anyengo, you've talked a lot about sensitization in this domain that is very little known and accepted in Cameroon. How do you think we should go about it? Is it just talking about it on TV, on radio, or do you think there are other ways we can go about bringing knowledge on mental health to Cameroonians?
Besides talking on radio, TV, and all of that, I think us, the practitioners, could try to do some voluntary services wherever necessary.
Okay.
I think if we can offer ourselves and do some voluntary services in some places, then the people see the benefits of that, then it could help to bring up the mental health status around us. And also, we should try as much as possible to break the stigma around it by teaching people, by talking to people about our cultural values and trying to destigmatize all the cultural norms that have been associated to mental health in one way or the other. That way you make people to be able to accept mental health better. Okay.
And Mr. Chengo,
we should teach them in school. From primary schools, we should teach children about their emotions. We should, you see, when you look at the sexes, I'll have to look at it. Men, for example, they actually don't believe in mental issues. They believe in weaknesses, inabilities, and which they are not proud of. So they will not discuss it openly and not generally with their wives, and their mothers may succeed to push it out of their throat, because the women have this other thing which they can read situations and they can have an approach to get you to talk. So emotionally, they will not express it. And secondly, if you are suffering from a mental issue, you are depressed, the man in your life may just say, take it easy, what do you need? May bring you a bouquet of flowers. That may do some good, but there may be need for real deep discussions, and there may be need for some issues. And if you are rushing between 2-3 appointments, we'll talk about in the evening, and when you come back in the evening, you won't think about it first. You say, okay, it's already late, let's see tomorrow, and this degenerates. So this is also because in the way we educate men, because when I say we educate, it can be in school, in the way mothers raise men, because mothers raise us. We are trained to pay bills, to lead, to be in front, to be strong, and so on. But you can be strong because you admit a failure. We have not learned that you need courage to admit a failure, to admit an inability. It takes a lot of courage, so much more courage than paying a house rent. And that type of courage we have not learned to know it, So the way we generally talk in primary, secondary, education, university, we should start discussing depression. We should start giving a face to it, a color, a name to it, and a way to identify or to see it manifesting, such that we can say, I'm thinking you are becoming depressed. And people shouldn't be ashamed to say it. Exactly. You're looking like you're developing anxiety because of the people should learn to speak like that in primary school and secondary school levels. If we start talking and teaching these things, and sometimes even the teachers who are in those states, and I'm not sure children will want to say that, So if we start discussing that at school level, we would have helped a lot. I was just thinking of something in that line. When the colonial masters came, I think there was also something that must have been that, if we should build the roads, build the schools, we should have mechanics, we should have doctors, farmers, and so on. I mean, I think it was like, if you are depressed or you need a relaxation therapy, it was luxury for an African man. How dare you be thinking about relaxation? You have to work hard. You have to put in hours. It was not a thing for an African to be thinking about, I am stressed. It didn't make sense to say I'm stressed. It didn't make sense. You need to put more hours. And then there was forced labor. You remember, there was forced labor, there was slave labor, there was all of that. There was no way saying that I'm not feeling comfortable, I don't know what is wrong, I have some issues. in the European community, they will ask you to talk to a therapist.
Yeah.
Here they will say, get up, my friend, you lazy fellow.
Kids get beat up for being moody.
Yeah.
Yeah.
They will say, get up.
Yeah, I remember like when they're like ADHD, attention deficit hyperactivity disorder. In Africa, we would just say the child is not strong head.
He's stubborn, yeah.
A child is stubborn. Meanwhile, that child is sick. So all of that needs to be considered.
So now that we're talking about the subject, what are the signs that could indicate that someone is dealing with, a mental situation?
They are different depending on what somebody is facing. But I'm just going to let me talk about simple things.
Okay.
If you are used to getting up at 6 a.m. and getting out of your bed and saying your prayers, brushing your teeth, jumping off to work, then all of a sudden you start finding that it's difficult for you to get up. That's already a sign that something is not right somewhere. Or you're losing sleep, you're losing appetite, you're gaining too much weight or losing too much weight. Those are signs that something is, and then physically you're not presenting any symptoms for psychosomatic, for any somatic diseases, but you are losing weight. You don't feel like hanging out like you used to do before. Something is happening somewhere. But those are not things that somebody will say that, okay, I'm sick. But you're gradually gliding down to clinical depression. And then you may get to the point where you just sleep in the house, and then the next day it's like, I don't feel like going to that work anymore.
I feel like I've been sick for a long time.
There are days, there are days.
Yes, there are days like that. There are days like that.
But if it's not recurrent, then that's
okay.
Yes, it has to be like that continuous for at least 3 weeks.
Yes, for at least 3 weeks. It has a length of time that you have.
It has a length of time, and then we have what we call the Diagnostic and Statistic Manual for mental health. You have to meet certain criteria for you to be diagnosed as being mentally sick.
Okay.
But it's okay for you to feel happy today and feel sad tomorrow. But if it's consistent, then something is wrong. And to pick up from where Mr. Chiango was talking about what should be done, I think that in the family unit, in parenting our children, we need to pay special attention to the feelings of the children. If you have a little boy who is throwing tantrums every time, shouting and crying, your reaction to that child, towards that child, could either worsen or ease the feelings that the child is having. So we pay attention to when the children are sad, when they are happy, when they are hyperactive, when they are. If you have a child that is used to jumping up and doing things, and then all of a sudden you realize that the child is getting into a little corner, and it's time to ask some questions. Maybe they're being bullied in school, or the peers are bullying them. So if we start from home and take care of feelings, then that's part of sensitization for mental health.
Okay. Let's open this conversation a little more into the chronic mental health situations. What are some of them, Madam Aningwe?
One of the chronic mental health situations that I can talk about is trauma.
Okay.
Trauma is one of the mental health situations that are very, very distressing. What is trauma? In layman's term, I can just say trauma is the distressing feeling you get after having a particular experience. When you have this distressing experience, it damages the mind. It damages the mind such that each time something triggers that particular experience that you've had, you feel some somatic symptoms. You feel headache, you feel fear, you feel lack of sleep, you feel all of that. Trauma, it's a very, very difficult thing to handle. As the doctor and Mr. Chiango has said, it cannot be seen. You're the only one that is feeling it. And when you feel it, you don't know what to do except a professional helps you out of the situation. And I'm very happy to say that the EMDR training has trained us to handle trauma so well. Because in trauma, it's because the experience that you've had not been processed. When you have an experience and it is not adequately processed, it is stored in the emotional section of the brain. When this trauma is stored in the emotional section of the brain, you have these dreaded feelings. But when you go through psychotherapy, like the EMDR therapy, the trauma is being transferred from the emotional section of the brain to the cognitive section of the brain. When it goes to the cognitive section of the brain, there, when you perceive these triggers, you no longer feel these dreaded symptoms, and all of that can be handled through therapy. So it's very important for people to seek help through therapy.
Okay. Before it gets to the point where there's a breakdown, how can people, better? What is healthy habits for, our mental health? But before we go to that, I forgot something. Let's talk about living with someone who has a chronic mental issue, a parent, a spouse, a child. How difficult can that be, Mr. Shengo?
It's like every challenge in life. When you say how difficult can that be, it means I am already letting somebody justify.
Okay, how do you manage it?
I don't want to have some people justify their nasty habits.
Right, yeah.
Yeah, you see, it's like every challenge. Your level of interest. We are talking about humanity.
Yeah.
This is the problem, which is in serious deficiency in every aspect of our human existence. I want to look at my country, humanity. They let another live. You live and let others live. This is the quality that, the value that we have to develop. When you are interested, when you simply care about anything, you nurture it. And so these are human beings like ourselves. And everybody can be in that situation. You have to be empathic because you can be in that situation and it can be in a split second. Most of the times, the fact that we don't master the procedures or the steps that lead to mental health, some people are almost at it, but they are still not aware. And even when they are being told, they don't accept, they are in denial. So that makes it even very much important for everybody to care about any person that is in a mental health situation. These are normal human beings who are facing a challenge. There are times in your normal life, on normal days, that you are actually reckless. You mess up even in your job.
Yeah.
You say things that you have to go back and apologize. You pose, you carry out some acts that you are ashamed of. That is because you were in a mentally, unhealthy situation just for us. So you just see this person as somebody whose own mental challenge has been extended consistently for a long time. The good news is that they can all be brought back into a normal condition. And I can only encourage you to do it because in the process you heal from a lot of things. If you have walked the journey of a mental patient, you move higher in your humanity, in your spirituality. You become a better person. And these are qualities that make you less likely to become a victim of a mental health situation. So you come out with a lot of benefits. But again, we need to share these things here. Looking, I think, normal for the more normal people watching us to believe that if they were in our situation, they will be able to go through this as well.
Let's talk about mental institutions in Cameroon. It's common to see, out of Cameroon, these institutions that take care of people who need real time and real attention. Do they exist in Cameroon, Reverend?
We have some departments of hospitals that are taking care of mentally ill people, but the percentage is very minimal. For instance, in the whole of Southwest, there is no mental hospital. In the Northwest, we have the Baptist Hospital in, I think it's
Bingo Baptist
Hospital. They have a department of mental health, I think. And if we want to talk about psychiatrists, I remember I've had to refer some people to psychiatrists that is here in Douala, in Lakantini Hospital. There is always an endless line there because the ratio of mentally ill people per practitioner is unbearable. is so high that sometimes you feel bad for the practitioner. It's difficult if you have one practitioner having to consult about 75 mentally ill persons a day. It's not real, because in mental illness, it's not the same like somatic diseases, where you can just say, okay, the temperature is 40 degrees, I do this or I do that, I send you for lab. You need a lot of time with these people. The average time per patient is something like 1 hour. And if we don't have those institutions, then I can say that mental health care in Cameroon is almost non-existent if we want to take the ratio, because I think it's below 2%.
It's below 2%.
It's below 2%, and I don't know whether the Ministry of Public Health allocates part of their budget to mental health activities, because the sensitization should be coming too also from the Ministry of Public Health, not just from private practitioners. Yes, I think that in every government hospital there should be a department that is in charge of mental health sensitization, and then I think the government needs to invest in training professionals, psychiatrists, psychotherapists, so that each of these, it's a right of the taxpayers to have their mental health catered for, I think.
We have some statistics. It's not Cameroon. We have Africa. In our last discussion in the Federation, the statistic came from Daniel saying 50% of Africans, on the average, have access to mental health.
Have access?
Yes, 50%.
Have access?
Yes. No, 15%.
15, as in
15.
1 5.
Yes, 1 5. 15%.
I was going to say 50.
Yeah, I was
listen, 50% of the Western world.
Okay, of the Western world.
So I want to say this is a global
problem,
a global crisis. So 50% of the world, we are talking about United States, England, France, 50% of the Western world, and 15% in Africa. And Nigeria is showing 1 of 4 people carrying a mental health issue. And if I use Nigeria, it could be Cameroon, it could be Gabon, and so I'm looking at the sub-Saharan region.
In the WHO statistics, about 80% of people suffer from mental health disability.
Okay.
And businesses lose about 60% of income due to mental health disability.
Wow, it's a little scary when we hear figures like this, and we think that mental health is still not getting the attention that it deserves. Well, we hope that things will change very soon. Now, I was reading, Madam Anyangoe, that there are actually biological factors that could increase one's chances of suffering from mental illness. Is that true, and how?
The biological influences on mental, yes, because if you have a chronic somatic disease, that could seriously influence your mental health. Take, for example, somebody suffering from diabetes. You're suffering from diabetes, it's a whole protocol of treatment and all of that. If you don't have the proper family support, if you don't have the proper medical support it drains you emotionally, and when it drains you emotionally, you can develop other mental issues. So couple with some of the stigma associated with some somatic diseases like HIV. Some people who have HIV/AIDS, the stigma associated with that can make the patient develop mental issues, and many other somatic diseases like that can push people to develop mental disorders.
If I may add something to that, I also think that it's hereditary.
Yeah, I was going to ask that.
Yeah, it's hereditary also, because sometimes it runs down in the family. And so if you have a relative that maybe has been suffering from schizophrenia is the very normal one that we see visibly, people on the streets and all of that. It's like we have what we call neurotransmitters. They are like the little agents that tell you smile, frown, all those kind of things. When they are disordered, they start giving you instructions all at the same time. Then you see, may tell you jump when you are when everybody is sitting and all of that. Then if that's something that is genetic, then it's very probable that it can be passed down to to your child or to a cousin, or if it runs in the family. Also, mood swings, like
yes.
bipolar disorder, those are things that run down genetic. One minute you are happy and all over the place, the next minute you are curled up. Just like the polar, just North Pole and South Pole.
Yeah.
It just occurs like that. One minute you're in the North Pole, the next minute you're in the South Pole. So those are some mental illnesses that can be genetic.
So for people who come from families with a history of mental illness, how should they go about? I don't know if it's possible to avoid totally or to manage. How do they, what should they do?
Mental health is managed. It cannot be avoided because it's not something that's, some of it is preventable, but like the genetic ones that we are talking about, if you have somebody who is already presenting symptoms of mental health in your family, and you know that you had a grandmother who had the same thing, stop thinking that it's a curse of the family, because it's just genetic. And what you can do is see a professional. If you see a psychiatrist, they may put you on a protocol, just like people with hypertension have lifelong protocol. People with schizophrenia also have a lifelong protocol. Those with bipolar disorder, they have a lifelong protocol. Also those who have clinical depression. They can put you on medication that you take, and then it brings you back to the normal way of behaving. But you have to accept that what is happening to me is normal. It's just like I'm having malaria. Once you accept that, then you get the right professional to prescribe the right medication. I must say that people should look for professionals, because the protocol for mental illness has a lot of side effects. And if you go to anybody, a general practitioner, and just say, okay, I'm feeling this, and they prescribe something, and you may not be able to handle the side effects. So it's always good to go to the psychiatrist, and don't be ashamed that I'm going to a psychiatrist.
Some people get these factors because I keep saying that when we say genetic, you may think that I won't marry from this family.
Because people think like that. People think like that.
But what I want to say is that there's also lifestyle and occupational influences, the type of jobs you do. Some people have found these things disappeared from their families because of their lifestyle, their beliefs, their faith, and their practices. Today, there are so many more ways of handling mental health issues that is not all of it is written as popularly in books as the medical approach that psychiatry teaches the world. So it is good for us to encourage people to discuss their issues, that's all. And like doctor said, meet professionals, because there are attitudes that are exacerbated by certain lifestyles, certain diets, certain environments, and certain practices. So if you regulate them, you never really get into a situation. Like if you are going to be likely to become involved in anxiety issues, their diets and their lifestyles and practices on a daily basis that would make you never have to take a tablet for that. And when you know about this, because you have shown signs early enough and you have received the guide necessary, you will certainly live a very, very normal life. And that will be beautiful. And these are cases like some of the cases of depression and schizophrenia blow out because of lifestyle and challenges that we go through in life. They would never have come to be a blown out, an outblown disease if you didn't go through certain other experiences in life.
Right. My next question, I hesitate a little bit following what I've heard, but I'm still going to ask nonetheless. Mental illnesses treatable on a permanent, at a permanent level? Madam Manyangwe?
Well, I think it's very rare.
Okay.
Yeah, it's very rare, but it's possible. It's possible. Something like they have most mental illnesses have a treatment protocol, and why I'm saying it's very rare, because most people don't follow the protocol to the end. By the time they go to a psychiatrist and they start taking the treatment, and the psychotherapist, and they start following up the therapy, they do 1, 2, 3 sessions, and they feel better, they drop. They don't continue. Meanwhile, if you follow your treatment protocol properly from the psychiatrist to the psychotherapist and all of that to the end, you can eventually have a proper treatment.
Okay. Anything to add to that?
I think they are treatable. I think that we have so many people. You see, everybody has a level of functioning that fluctuates. You know, everybody has a level of functioning that for a functional level that fluctuates. Everybody. So if you have to check your level of performance. So as long as your level of performance has improved, you're healthy.
Okay.
You know, we get to a point where we can become dangerous to the next person. At that point, we can say the disease is dominant. Okay. So when you have, if you were violent and you're no longer violent, even if you are not able to run 100 meters and win the race, you are functional, and that I call you a healthy person, because at that level, you can be useful to the society. So to me, I think we treat a lot of mental cases.
I was going to say that we have a lot of functional mentally ill people.
Exactly.
Yeah.
Exactly. That's where the controversy comes in. Yeah. You're functional, but
you're mentally ill.
You're still mentally ill. That's what I'm talking about.
Okay.
So, because psychotherapy is just a helping process that brings out the potential that is in you. So when you meet a psychotherapist and they help you to bring out this potential, and you can have a healthy functioning spirit, then that will be fine.
Okay. Now, what do you all think of people who take family members or friends who have mental health issues to traditional practitioners? You know, because that used to be quite the thing. They used to take them to doctor who would keep them for some time and
whip them
and beat them up. What's your opinion on that? Is that with you?
I think that we need to externalize a lot of beliefs. Again, that was the best they could offer at the time, because at the time, since mental illness was associated with evil spirits and traditional violations, so it could only be the traditional practitioner who could exorcise whatever was happening. But now that we know that mental illness is just a disability like any other disability, people should seek proper care. I think that if the traditional practitioners have medical proof that they can heal and restore the mentally ill person, I don't have anything against that, but it should be something that's conventionally sound, not like we used to see people being chained up and beaten. That's a violation of their rights.
Okay.
Exactly. It has to do with the medical protocol. It's scientific. Even when they talk of spiritual, or we go beyond the physical, or tablets, injections, and so on. We have, in the last World Mental Health Federation conference, we had the Indian doctors who brought traditional procedures, and they could show what meditation does to the brain waves and frequencies, what sound could be used, what essence can be done. And these have been taken with somebody like Deepak Chopra. They have taken this thing in neuroscience to do measurements that medically can be proven that this can have this type of influence on the brain and improve on this level of performance. So if you don't have a clear-cut procedure that has shown systematic results over time with documented proof of it, I think you are gambling. And I will not encourage anybody to do things like that.
All right. Now we're getting towards the final moments of the show, but the idea of the diary is to bring solutions, to help, to solve problems. So for the majority of people who face, the basic, if I could call them that, mental health issues, stress, fear, worry, how do they protect their mental sanity? What are the good habits to adopt to be well mentally? Let me start with you, Madam Mayangwe.
I think the first thing is to change your thought pattern. Okay. As any normal person, you change. Like there are many books about positive thinking. Yeah. You change your thought pattern. When you change your thought pattern, you change the way you feel, and then it eventually changes the way you behave. So you start by changing your thought pattern, and then it will help you.
But how do you change your thought pattern? Because people hear that change my thought. Okay, how? How exactly? What do you do concretely?
Well, you have a positive outlook.
Okay.
Yes, you try to have a positive outlook about so many things. For example, if I call Mr. Shangong today, he speaks rudely to me, and I know he has never been speaking rudely to me, I should think that maybe something
He has a mental
happened.
issue.
Something probably provoked him to speak rudely to me, and I should not react adversely.
Yeah.
That's looking at things positively. And every other aspect, just look the way things come your way. Just everything that comes your way, look at the positive side of it first, before let it fail you before you consider the negative side of it.
Okay.
That way you're already changing your thought pattern positively.
Okay. Mr. Shengo, what else can we do?
There are many levels, and if we work together, it will get better results. But I'm a beauty therapist, I'm a massage therapist, and I want to say learn to be good to yourselves. It's very important that you pamper yourselves and that you associate yourself with enabling people and nice people. You are not obliged to live without professional training in a toxic environment. If I have skills to manage toxicity, I can move in those environments. So help to teach yourself to frequent healthy environments. Go for a pedicure, a facials, a massage. You don't need to question whether it will be helpful. Just go for the experience. Have a sauna bath, get a body scrub. Most of the time they'll tell you you're wasting money, because you can't actually see the underlying effects of all of this
immediately.
If you tell somebody that I want to see, I'm been moody, I want to see a therapist, a psychologist, you say you're wasting money. But if you have diarrhea, everyone say rush to the hospital, and they'll say, do you need some money for drugs? So in the same light, don't wait for people to tell you what to do. If you're feeling moody, look for enabling experiences. Go for a walk. Call your best friend and have a good chat. Go to a restaurant, sit and have a good meal. Don't always wait for the food that is cooked at home. Wait for somebody to serve you. Dress well, do a good makeup, style your hair nicely, and look beautiful, and be happy when people tell you are pretty. Do those things. Do those things, and come over for a massage.
Definitely, you enjoy it. I've had the experience, so I know what I'm talking about. And Reverend, is there anything to add to that?
To add to what you were saying, that self-care is very important. Most of us work for other people. Sometimes when I'm running workshops, I ask people, how much of your salary do you spend on yourself? And people have to think, on myself? No, I work for the children, I work for all the family members, I work for this, I work for that. But you need to take care of yourself. When you get up in the morning, before you step out and you look in the mirror, do you like what you see? Once you start feeling good about yourself, that's the first stage of keeping your mind healthy. Because when you step out of the house with a fresh and healthy mind, you are protecting yourself from whatever negative energy is out there. Because whatever comes out there, you'll be able to shove it and go about your way unaffected by it. But if you leave the house moody, you are angry that the child has done this, or you're quarreling with your spouse, by the time you get out there, you have already put yourself in a very vulnerable mental state. So the next person that's going to say anything, you will shout, and then you end up having a bad day. First thing, take good care of yourself mentally. Eat healthily.
Okay. Eat healthy doesn't mean you eat too much or eat everything you like.
Yes. And look and feel good.
And nourish yourself spiritually also.
Of course, that's right.
Yes,
absolutely.
Nourish yourself spiritually. Look for good spiritual counseling as well.
And so if someone's watching us and they feel that following the discussion, they are having some issues, they need to talk to a specialist, what would you advise them to do at this point? Anybody can take this one.
You call us.
Call any of us.
We are all practicing.
We are practicing, and we are trying to come up with an online counseling services, because we realize that with the stigma that is around mental health, people don't want to go out to these mental facilities. So we are trying to come up with online counseling services that you could log in, and you get equal amount of services that you will have face to face.
And even before then, we will handle your information ethically. You don't have to be uncomfortable sharing.
Right. Before we end the show, we'll tell you exactly what to do. Now, I wanted to learn a little more about the Cameroon Association of Clinical Counselors. Someone please just tell us what the association is about, your activities, how long you've existed, and what you've been doing so far.
The Cameroon Association of Clinical Counselors, of course, is an association made up of psychotherapists and clinical counselors and psychologists in English-speaking Cameroon.
Okay.
Yeah, because I must emphasize that because there is a French-speaking counterpart
All right.
Of the association. And what we do is we meet annually and we share knowledge on what is current in the practice, and also we exchange our competencies in different ways. For instance, if I have a client that needs EMDR therapy, you refer. So it's like a community of practice where you know the strengths. You have a child psychotherapist, you have somebody that is interested in old people, you have people who are marriage therapists, and so we
drug addiction therapists.
Okay. Yes, so we form this community of practice so that we can refer each other and use our competencies to function better.
Okay. So outside that, are there any other activities you carry out, especially since we've been talking about sensitization and the need to do more? Are there other activities outside that?
We are currently working on developing some social media supports that can make access to the public. Trying to work on developing a website. That was our last meeting that took place in Bonaberi. We're trying to have a Facebook page and maybe Instagram. We'll do something on a website design so that we can open up to communicating with the public and with every level of the society. And it's not by accident that we find ourselves on this platform.
Yeah.
So you can start making use of this opportunity that STV has given you, the public, to make use of the team. It's a team of so many different professionals, like Dr. said, and we try to do our best to make our community as healthy as possible.
And so far, for the World Mental Health Day, we've been carrying out activities. So far, for the past few years, we've been carrying out activities for World Mental Health Day, just to try to sensitize the public on mental health issues.
Right. And I also gather that you've been working very closely with the World Federation of Mental Health.
Yes.
Exactly.
Right.
We attend the World Conferences. Last time we were in New Delhi in India.
New Delhi in India.
For the World Federation for Mental Health. And then the very last one last year was in Latin America.
Okay.
And,
Mr. Shangon was there.
We're looking forward to the one in 2021. It's going to be in London.
In London, yes.
Okay. All right. Please do feel free to come back on STV and talk about your activities. We want every Cameroonian to be aware of mental health and to get the help they need for those who need help. Now, we said if you have an issue, you can get in contact with them. They have to know how to get in contact with you. Let me start with you, Reverend. If someone wants to get in touch with you for their mental health needs, how exactly? How can they contact you on social media, on Facebook, or where can they come to talk to you?
I have an office.
Okay.
My office is in Kumba, in Church Center Kumba.
Okay.
Where it's Presbyterian Counseling Services.
All right.
And a lot of people know about that office already, and they already contacted me through my number.
Okay. So feel free to, but they can also reach out to you on social media, I imagine.
Yes.
Okay.
I have some clients that are reaching out to me through social media, through my Facebook page, through Messenger, through LinkedIn. I have a lot of people getting through that to get to me.
And Madam Jackie Anyangwe?
Well, for now, you can only get to me through social media.
Okay.
You can get to me through social media. You can also get to me. I do a lot of voluntary services.
Your name on Facebook, for example, so people can know what to type.
Jackie Anyangwe.
Okay, right.
Jackie Anyangwe. You can get to me on social media. I think that is the easiest way to get to me.
Okay.
Because it's public.
All right. Mr. Shango, I mean, they already know, but we'll just remind them.
I prefer they come to Viva Coiffure Bonaprise.
Yes,
for
please
mental
do.
health issues, Viva Coiffure Bonaprise. But of course, I will link them if they use my Facebook page and Messenger. Yeah, I'll direct them.
Please feel free to. If you go to Viva Coiffure, just the environment, you start seeing a solution to your problem. And if you're still not sure how to go about it, please write to us on the diary on Facebook. Just type the diary, leave us a message. We'll get in contact with you and maybe hook you up with one of them, one of the psychotherapists. So feel free to. It's completely confidential. It's going to be between you and your specialist. Well, thank you all so much. It has been very enlightening to have you all, and I'm sure that the viewers have learned so much.
Thanks so
Hope
much.
that you'll be back again very soon.
Yes, we will.
Of course. Great, it's a promise.
Yes.
All right, you take care. Thank you so much for watching. We hope that you've learned something from today's edition of the diary. Take care of your mental health too. Okay, do not forget to do the right things, think positive, take care of yourself. Okay, pamper yourself every now and then. When you do that, when you wash your hands and you wear your face mask, don't forget to do that as well. Take care. We'll see you next week. Okay, bye bye, and we love you. So bye bye.